Welcome, everyone. We'll just give people a minute longer to sign in for this session, and then we'll get started. Welcome. It's nice to see everyone signing back in after lunch for this session. All right, let's get started. Hi, welcome to the first breakout session of this 2025 Culture of Data Conference. I'm Allison Rosenthal. I use she, her pronouns, and I will be moderating today. We also have Dennis Wright, he, him pronouns, who is managing the Zoom, making sure the tech is running smoothly. You are all muted now, but if you have a question during the Q&A sessions, please feel free to unmute, and then the chat will be available throughout the session for you to use to put some questions. And then we're also, see a lot of you have already done this, but we also encourage you to put in your pronouns into your Zoom name, and you can do that by clicking the three dots on the corner of your picture, and can change your text that way. So we have one presentation during this session, and they will present for approximately 25 minutes, and then there will be 10 minutes for Q&A afterward. And I'm really excited to present these two speakers today. We have Tate Stidley here and Diamond Roybal, and they are presenting on the flexible data collection for evaluation in suicide prevention outreach, the Colorado Gun Shop Project. And I'm really excited for this session because, as I was telling the speakers, I used to work in CDPHE in the branch that does this program. So I saw the infancy of this idea when it just got funded, and I'm just so excited to kind of see the results and how it's grown and what what they found out. So with that, yeah, take it away, Tate and Diamond.
Thanks, Allison. Yeah, I was gonna say you might know more about it than I do, so I'll be let me know if I say something that sounds wild. Um, can folks see the screen now? Excellent. Um, so hi, like Allison said, my name's Tate Stidley. I am the evaluator for the Office of Suicide Prevention. With me today is Diamond Roybal. Diamond, do you want to come off mute and say your programmatic mouthful?
Yeah, sure. Hi everyone. Diamond Roybal, she, her pronouns, and as Kate just said, I have a mouthful of a title. I'm the Comprehensive Suicide Prevention Program Manager here in our office. But luckily, you won't get to hear me talk that much today. I think Tate's going to take the reins and I'll kind of be here for support.
Thanks. I also want to call out all of our colleagues in the Office of Suicide Prevention. If someone would be nice enough, maybe Diamond, to put the link to our website in the chat. Our website is a very easy one to remember. It's coosp.org, coloradoosp.org. Where the folks that you see on your screen right now, working with Lena Heilman, our office director, to be the lead entity for suicide prevention, intervention supports, and postvention efforts in the state, collaborating with communities statewide, ultimately to reduce suicide in Colorado. And one of the reasons that we're really excited to be talking today at this Culture of Data conference was OSP's commitment to equity. All of our programs are structured around focusing on how we can address inequities in Colorado to try to reduce suicide. We reduce suicidal despairs, attempts, and deaths by identifying, dismantling oppressive systems. So we believe ultimately that eliminating discrimination is suicide prevention. And within that, we honor the intersections of identity and geography. So you'll see us talk about rural communities today geographically. You'll also hear us talk about gender identities, and we won't talk as much about race today, but all of our programs do focus, as you can see on these symbols on your screen. These are the core priority populations that we try to fit into all of our partnerships that we prioritize with our community work. The Gun Shop Project is one of the OSP programs that also embodies this commitment to equity, and it primarily focuses through addressing inequities that are due to access to firearms that disproportionately affect suicide amongst three groups of Coloradans, which are men, rural communities, and veterans. For men specifically, there's an interesting dynamic to call out within suicide prevention that men are across their life course more likely to experience social isolation compared to women. However, we know that women are more likely to attempt suicide over the course of their lives. However, we notice consistently across all over the country that men more likely to experience higher fatality rates from suicide. So one of the discrepancies with men experiencing higher rates of fatality, where women experience higher rates of attempts, is partly due to access to firearms and the lethality that comes with the use of firearms in suicide attempts. Rural communities and veterans likewise experience similar disparities, and we're going to show some data on the next couple of slides that kind of highlight those discrepancies and why firearms are so fundamental to understanding them. And then OSP's Gunshot Project strategically outreaches the above populations on this slide to increase awareness of suicide prevention strategies, connect firearm owners with suicide prevention partners, and reduce stigma around suicide. So I'm going to rattle off some statistics here in the next couple of slides, but I also wanted to take a minute to kind of frame this because each one of these next slides that shows data reflects a life that was affected by suicide, whether that's ideation or a fatality. So whenever we present these numbers or we show data, we just want to take a moment to realize that we are talking about the families and friends and loved ones that we know that have been lost to suicide. And we want to be respectful of that and keep that in mind. In the United States, for every one suicide fatality, it's estimated that 135 people are directly affected by that loss. So this is something that deeply affects our communities and those who survive. And this quote is from Irving Silikoff that reads, "Statistics are human beings with the tears wiped away." So even though these slides are kind of devoid of the emotion that might come from the loss of suicide, it's definitely reflected in the data. So this first one just shows where Colorado kind of shakes out across the country, across all 50 states. You may have heard in the news that Colorado regularly falls in the top 10 of states that experience the highest fatality of suicide rates in the country. We're not alone in our geography, though. This map from the CDC shows from 2022. We're, along with Wyoming, Utah, New Mexico, Montana, North Dakota, and Idaho, kind of in the western Rocky Mountain region, are experiencing disproportionately higher rates compared to the rest of the country. So while we work really hard in Colorado to try to identify the risk factors and protective factors to try to turn the curve on suicide, we have seen the rate in Colorado decline over the past 2 to 3 years slightly. And we're in a cohort of other states that are experiencing the same phenomena. So we're not alone in trying to figure out how can we change this trajectory for our state. And then focusing on the topic today of suicides within Colorado, focusing on firearms, this is highlighting some of the data from the vital statistics system, where we see that male suicides make up 59% of male suicides use a firearm compared to 30% of female suicides. And overall, across the state, firearms make up the most common mechanism used to attempt a suicide. Focusing on rural communities, there's some interesting discrepancies to just kind of call out in the data. Rural counties, as defined by the Department of Local Affairs as both rural counties or rural resort counties, are more likely to see suicides completed with a firearm compared to urban counties. About 11% more suicides use a firearm in rural counties than urban counties. And when we look at the rural counties, one of our colleagues, Catherine Harvey, would call out that not all rural counties are the same. And so the rural counties that are not based on resort economies, which you see with the yellow line there, tend to experience higher rates on average than rural counties that will be defined as rural resort by the Department of Local Affairs. So there's even discrepancies within that category of rural itself. And then if we think about the impact that happens in our veteran communities, we know from the VA data from 2022 that veterans comprise about 7.4% of Colorado's population, but were about 15% of Colorado's suicide deaths. And the suicide rate for veterans was estimated to be 47.6 per 100,000, while the general population was estimated to be around 27.1 per 100,000. looking at the data from our state data for the vital statistics system, data between 2019 and 2023 also shows that 73% of all 73% of all veteran suicides used a firearm, which is even higher than the graph that we showed previously for the statewide average. And then within the veteran suicides that used a firearm, we see again that discrepancy for men and women, where we see 75.3% of male veteran suicides using a firearm compared to 55% of female veteran suicides. All of this kind of emphasizes an important strategy that we prioritize within OSP and emphasizing that means matters. So drawing on other research in suicide prevention, we know that for every one death by suicide in the United States, there's about 30 attempts that do not result in a completed suicide. So for one attempt, we know that there are many attempts. I'm sorry, for one fatality, we know there are many attempts behind it in the population. Over 90% of those who survive an attempt, though, do not go on to die by suicide, which is a message that we try to emphasize with a lot of our community partners, that surviving a suicide attempt is overwhelmingly associated with going on to live a life that is not affected by another attempt or a successful attempt, or a complete attempt, I should say, excuse me. One study of attempt survivors also emphasizes the importance of timing around the initial ideation of suicide and the decision to attempt a suicide. In a study of attempt survivors, so people who tried to die by suicide but survived, 74% of those said that their time between initially thinking about suicide and then attempting was under 10 minutes. That's an important factor to take away when we consider the case fatality rate with firearms and suicide, which is estimated to be about 90%. All of this together means that lethal means matter. So anything that we can do as a strategy to increase time and distance between initial decision to attempt a suicide and obtaining access to a lethal means is something that can be used to try to reduce the suicide fatality rate. I'm going to transition a little bit into like some of the public opinion data and the prevalence of firearms in our state and how that also affects the suicide. So that's kind of our main messaging behind why lethal means safety might be an effective strategy. Looking within Colorado from the Colorado Firearm Injury Prevention Survey data, we also know that most Coloradans don't think of suicide as the most common risk associated with a firearm, in terms of a firearm death, I should say. The mode category of response for perceived belief of risk for firearm death in the state was homicide at 33%. When you compare that to about 5 years of data from the federal data sources, 2017 to 2021, 75% of all firearm deaths in the state were due to suicide. So there's a bit of a disconnect between what the average Coloradan might imagine their risk of firearm death being in the state and what the actual data pans out to look like. And that's also to be taken with the fact that firearm ownership is really common in Colorado. A lot of Coloradans own guns, and they own guns safely, and they own guns without incident. And that ownership of a firearm in Colorado is by far very common. 1 out of 3 Coloradan homes will have a firearm in it, according to the BRFSS, and the COFIP survey estimates that to actually be closer to 2 out of 5 homes. And if we take that ownership question in the BRFSS and we do a crosstab based on those who said they also experienced suicidal ideation, we again see those risk factors play out that I was talking about earlier. 42% of men in Colorado who say they experienced suicidal ideation said they also had a firearm at home. That's higher than the comparable rate for women. Again, we see that factor play out again for folks who say they live in rural areas. 47% of rural Coloradans who said they experienced suicidal ideation said they also had a firearm at home. And then when we look at insurance type, which is, I'm going to use a proxy here to kind of capture our veteran community, because the veteran crosstab here actually doesn't have enough data to pan out. But the insurance question did, interestingly enough. 51% of Coloradans who said they experienced suicidal ideation and used military medical insurance said they also had a firearm at home. So that brings me to talk about the Gunshot Project as we have implemented it in the state. The Gunshot Project has been implemented since 2014. You heard Allison talk about it being around in her previous roles at CDPHE. I came on board in 2023, so I'm relatively new to this project, but overall, this program has been around for more than 10 years, and it's an education and awareness project partnering with community firearm advocates, or CFAs, who outreach gun shops, shooting ranges, and firearm safety course instructors to promote lethal means safety for suicide prevention. We emphasize the importance of our CFAs because they are considered to be safe messengers for suicide prevention and trusted messengers who can bring a message of credibility to these communities. And the core message that we hope that to communicate with this outreach effort is that temporarily limiting suicidal individuals' access to a firearm is a critical aspect of firearm safety. Notice the emphasis on temporary there. We are not advocating for full removal of a firearm forever. This is meant to be kind of like that 10-minute crisis period that we're emphasizing. The importance of temporary here can be really effective. I'm going to kind of skip these next two slides. You guys have access to the PDF through the SHED website, so you guys can peruse this as you feel. But my main takeaway here is that OSP provides literature and materials for those CFAs to outreach communities. We print these and provide them to our CFAs at no cost, and we also have electronic versions of these so they can provide them in multiple formats to the community. These just provide messaging and some myth-breaking information for those communities to outreach so that they can feel empowered to talk with customers in their gun shops or other gun owners in the community about common things around suicide prevention that can help bring credible, safe messaging around suicide prevention. This one I'll just call out: the frequently asked questions for gun shops and suicide is probably one that's really interesting because almost anything you could think of where a gun shop would say, well, but we try to have that information handy for them to reference. This slide is showing the 10 current partners that the OSP operates with to support this program. So we have a range of partners all across the state. We're actually active in all 64 counties. And those counties that aren't served by one of these 10 partners on the bullet points here is also outreach directly by a position within the Office of Suicide Prevention that does outreach and coordinates the Gun Shop Project. We also collaborate with the Veteran Affairs Western Colorado to coordinate outreach for 10 counties on the Western Slope as well. There's been some research done on this in published journals. Wright, Kelly et al. In Injury Prevention just a few months ago called out a cross-sectional survey of participating gun shops within our gun shop project in Colorado to show that gun shops are willing to engage in suicide prevention and that the materials provided to these shops can facilitate conversations with consumers about safe storage and seeking mental health supports. But being on the other side of implementing this program, we've also noticed that record keeping for repeated visits and keeping track of the dose of these outreaches has been a challenge. And that's what I'm kind of here to talk about today. So the original data tracking for the Gun Shop project was emphasizing a role of the CFAs tracking their individual visits in Excel sheets. And it was pretty rudimentary, where we would have a spreadsheet where they could track up to 3 visits per site. And that was meant to allow it to get us some dosage of how those visits were going over time. The pro to this was that it was easy to implement. Folks felt very comfortable with Excel sheets, and it empowered them to kind of be their own record keepers. And we could use that data to meet our grant deliverables for the federal programs that fund this. The con to this, though, is that the manual data entry was rather cumbersome and the data quality was highly variable. We did not always get reliable insights across all of our grantees, especially if the grantees were to change over fiscal years. That prompted us to seek new ways to more or less automate this process as much as possible. So we turned to Qualtrics to try to solve this problem. And this is pretty much our first attempt at trying to solve it. I'm sure there's better ways to do it. Would love to hear if folks have insights. But the way we thought about this was trying to emphasize reliable and easy data entry. As you can see from these screenshots on a smartphone, this is a tool that they can access through a URL to fill out their site reports, even in the field after they complete a site visit. We meant for this to be robust to staff changes so that if people come and go on this project, it would not take a lot of training to get them trained up on how to fill these out like we had with the previous Excel sheets. It is also easy for us to implement the data in this in Qualtrics to help us make decisions within OSP using products like Google Looker Studio to create dashboards to show how many visits are happening and how well they're going each month. And we also have reliable version control through this so that we can keep track of records so that if we know people say they visited a site and they want to change a record, we have the ability to actually see in real time what we need to edit and keep track of it. And we don't lose those records over time. Like if we handed out Excel sheets to people locally, they could edit them and change them and we would not have a record of it. And that's not to say we don't trust the information that's being put in there. It just helps us to keep track of things when things go wrong. So this new data tracking system allowed us to be robust to the staff needs of the local community firearm advocates. We get much better data quality and data standardization across all the grantees, and it's easier to use for the local grantees so that they can get trained up and fill them out quicker. A downside to this, though, is that we're still struggling to figure out how do we capture unique site visits. And if you're into data validity or data conceptualization, you might be thinking, what does that mean? Well, just as an example, if you go to a gun shop and you outreach with the staff, but then that gun shop, all the staff changes over, new management, new staff come in, and then you're a CFA and you go to visit them and you're talking to all new staff. Have you visited a new gun shop, or are you still talking to the same site? And so there's an element of here that we're trying to think through of like when we outreach these shops, are we outreaching a shop, a location, or are we outreaching the staff? And so that's a question that we can kind of sink our teeth into and chew on a little bit, but it's one that we're thinking about. This is actually a screenshot from our data dashboard for Google Looker. And over the past year and a half, we've tracked up to 825 visits with incomplete data for March of 2025. And overwhelmingly, most of these visits have been well received, 71% in fact. Here's some quick numbers just to kind of show that this is stuff that we did not have at our fingertips before, and now we can calculate this really easily. We can see the number of locations that were visited, the types of locations that were visited, and we can see the amount of materials that were distributed by each of our grantees when they were handed out. So this is information that, 3 years ago, we could not have produced without a lot of effort going into those Excel sheets and trying to calculate a lot of messy data. This is stuff that we really truly have at our fingertips now. And from our grantees, we've been gathering narrative responses from the information they provide during their site visits. And so I showed on this slide the pink and teal lines of unsure or not receptive. These are some of the themes from those visits that we're seeing. In the unsure receptiveness category, we're seeing people say that they're going into places that they visited before and they're seeing the same materials that they handed out still on the counter, still being displayed to patrons, but it doesn't look like anything's been picked up. And so while we're encouraged that shops have the material out on display for their patrons, we would be a little curious as to like why that material is not moving. And so we would like to see that material being picked up. So trying to figure out how to better work with our partners that way. Sometimes our grantees will go into a shop and say they had to network with staff several times before they talk to management. And those initial visits can sometimes feel like, well, I don't know if I'm really getting anywhere until I talk to the management. But that's part of building good relationships. And then sometimes they go into a shop and they're just very busy. You could imagine going into any retail outlet around a holiday season and just seeing it being really slam packed with people. Staff that are busy working with customers may not be in the most gracious attitude to talk with somebody who's trying to talk about public health and suicide prevention on that day. And that's just, we all have jobs. And then the themes in the not well received, slightly encouraging here is that we're not seeing a lot of people just outright turn us away when we show up into a gun shop. Sometimes people show up to stores and the store is closed. It might have gone out of business that day. Firearm retailers can come and go just like any other business. Corporate policies at bigger name stores that might be chain stores might prohibit the distribution of external materials. And then sometimes staff will just give you a polite brush off and there's not a lot you can do to get them to engage you. And that might be due to skepticism around firearm regulations or firearm safety. But that's why we're trying to rely on our CFAs to know how to navigate those conversations. And they really, truly are. Some of these folks have been doing this for 5+ years and they know how to navigate those conversations really well. And they're like, if we're not making any headway, it's better to not press. And just a few positive interactions here so that I can wrap up and let us get to some Q&A as we get really, really close to time here. These are just a few direct quotes from positive interactions where our grantees were saying that everyone was so nice and amazed about how we would make the commute, and this was like a several hour commute to their location and leave flyers. They asked a lot of questions about the local community mental health center. I left my card for literature refills. Or after they read the information, they asked that we put our information on the center of the bulletin board as it was very important. And then they said that he is new at the store and had not heard of the gunshot project before, appeared to be receptive to messaging. I left materials and said I will follow up in approximately 6 to 8 weeks. And so we are seeing, through these are just a few snapshots, but given that 71% of our visits are seen as positive interactions, this is kind of emblematic of what that's happening when people are having positive interactions. Okay. In sum, and I want to call out like some of our funding sources here. We've helped kind of shepherd this program from 2014 to a statewide program in 2023. And we've been able to leverage competitive federal funding opportunities through the CDC PHHS block grant, as well as the SAMHSA National Strategy for Suicide Prevention implementation grant to sustain this programmatic work. So this program is completely funded through federal dollars. Over the past 11 years, our data reporting has evolved gradually to establish more consistent and sustainable reporting that the CFAs can do and that we can get insights out of. An important takeaway, I think, is that gunshots are not static with their staff or location. Being able to support our CFAs to report this data with minimal effort on their end, but maximum insights on our end has been really helpful to make this program better document its implementation and how we can administer it. And then also I want to just call it that our CFAs are really great. They know their communities. They're working to build better report and building better reporting tools for them has helped us demonstrate the impact of their work better. And we can see that in terms of this fiscal year, our GSP program was called to be a lead strategy for one of the governor's WIGs. And so all the data that's going into this WIG dashboard is also coming from these CFA reports, which is just a level of reporting we wouldn't have been able to do a couple of years ago. I'll wrap up. I'll just mainly say that our main focus here is to try to build on peer learning from this, and that we also want to continue to apply for competitive grants in addition to grants from DHHS to support this program going forward. So I think I've hit all my main points. I'm over time, so I'll give grace for any Q&A now.
Thank you. That was such a great presentation. And just also wanted to call out that you left on such a nice content slide for us to remember some takeaways, just in accordance with what we heard earlier today in the better data presentations. Yeah, so I want to invite everyone, if you have questions, feel free to drop them in the chat. Also, you can come off mute. I can get us started. Yeah, I guess this is more in your background, but I guess I was just wondering if you could tell us a little bit more about this Colorado Firearm Injury Prevention Survey. How often is it administered? Um, and I guess I'm just like curious if you have any kind of like insight on some of the differences in the findings between like BURFIS and the Colorado Firearm Survey and kind of like what those differences may mean.
Yes. So the COFIPS is funded by the Office of Gun Violence Prevention. It's administered out of CU Inshut's Firearm Injury Prevention Initiative team. I'll put a link to their website for the survey. They are currently administering the second statewide wave. So that I believe that might be in the field right now. And if I can navigate Zoom, I'll put it in the chat. But that is a new survey being implemented through OGVP, administered through CU Anschutz. And they operate that fairly independently, but they do have important questions around perceptions of risk and firearm harms and injury that have been really, really insightful that came out around 2024 or 2023. So
Oh, Tate, I think you went on mute.
oh no, how much of that was that all muted?
No. It was
Okay.
just like the last couple of sentences.
But yeah, it's separate from BURFIS, and it is we do have a little bit of overlap on what those questions ask. And one of the discrepancies in there is that the BURFIS question actually says it has a framing at the beginning that says like 75% of all firearm deaths in the state are suicide, and then it asks if you own a gun. So it's kind of suspected that there's a little bit of social desirability response in the Burfist data right now, whereas the COFIPS question is much more like, uh, you know, it frames the initial survey even at the introduction to be like, we're going to ask about guns and we want to know, and kind of frames gun ownership as a more normative behavior. And so I think there's probably just a little bit of social desirability in how the Burfist data are being framed on the questionnaires.
Oh, thanks. And it looks like M dropped a link to the survey in the chat. So if you want more information, please feel free to go there.
Yes.
Thanks, M. And yeah, and then I saw that there's some dialogue in the chat, which hoping that we can have this dialogue aloud. So I'm going to say Rachel's question aloud and then hoping that Diamond can answer it live as well. So Rachel asks, can you tell us a little bit more about who the CFAs are, what training they have, volunteers or employees, etc.?
Yeah, just to share a little more and reiterate, usually the firearm advocates are a trusted messenger from the community. So they are usually live or work in each of the counties where we fund the grantee. And they can really range, from having different types of either personal or professional experiences with firearms. And usually they're firearm owners themselves, just because that message tends to land better at a shop. But we have some folks who are veterans. Some of them are employees at our grantee agency. We have folks who are possibly like retired police officers and law enforcement, or folks who are just firearm, like part of the firearm community. So maybe they do different types of safety trainings at ranges and things like that. So there's a wide variety of CFAs at the local level. Um, and then the way that our grant program is structured is that we have grantees across the state, which Tate had mentioned, and then the grantees get reimbursed at a set cost per site visit. So each grantee might have a different structure. Like it might be their employee who is going out and doing the visit for at the gun shop or the range, and they get reimbursed for that, or they partner with one of those community firearm advocates already to go and do that work for them. So our contract kind of lends some flexibility as to whether or not it's going to be the agency to do it, or if they contract with a one of the advocates from their community to relay that message.
Yeah, thanks for explaining more of that background. Nicole asks, are firearm partners engaged in community conversations on what efforts they see and think would be effective and included in creating resources, flyers, etc.?
Yeah, we've actually been talking about this recently because our materials are a little bit like probably long in the tooth. We need to update them and refresh them a little bit. But we've also promoted new things along them with things like man therapy to try to supplement the materials as well. And we just recently had like a meeting with our grantees to talk about what is working in terms of like reaching our rural communities and our older adults in Colorado. And part of the questions that have come up is like, how can we maybe move some of the content around on the flyers? Because one of the things that doesn't resonate is getting a lot of statistical facts at the top of it, but then seeing like what you can do around messaging is really helpful. So we are talking with our grantees about how we can improve them over time. So we do need to probably go through and refresh some stuff, but it's definitely something that we want to do in collaboration.
Thanks. And yeah, and as we wait for any other questions in the chat, I just had another one I'd like to throw out. Just wondering if the gun shop project has been adopted by any other states or if you've been able to collaborate with any national partners.
Yeah. Um, CU Boulder, the injury uh, IPV center is Sabrina Mattinson Arredondo has been doing a research study on other gunshot projects across the country, and they were trying to survey other state offices to see if they could provide details. And there are multiple other states that implement gunshot projects, but it's not clear when they were established in relation to ours. I know that Colorado's was initially established in an inspiration to one that was created in New Hampshire in 2009. And so other states have also kind of adopted it, but there hasn't been a uniform kind of implementation to it. A lot of them have implemented it in different ways. So we're, as far as I'm aware, we're the only state that has county by county coverage in the way that we've stipulated for our grantees. And we're able to document the number of visits that are happening over time through like a system like we've established so far. I know that they tried to survey other states to get responses, and it was really hard to get a consistent response from other states to say what their implementation looked like. So I think there's a lot of different levels of maturity. Like some states will implement the program, and being able to sustain it or fund it over time can look different in different places. So I think there's probably lots of states implementing similar efforts, but the how well it's been developed and how sustainably it's been funded can probably vary a lot across the country.
Yeah, thanks. That's interesting. Yeah. All right, I will give one more pause to see if we have any other questions from the audience. All right. Seeing that we've provided so much great information already, I feel comfortable closing out the session. So I just have a couple announcements to make. Thank you all for attending and for engaging in the Q&A. So if you'd like to follow up on this presentation, slides and other handouts from speakers are available on the Sched platform. And concluding the conference, you will receive an evaluation form via email. Please fill this out. Even if you only attend a portion of our conference, it's really helpful for our planning committee. And we have made a lot of changes this year in response to feedback we got from the survey last year. So letting you know that we are taking this data and implementing it. Um, and right now we have a scheduled 15-minute break before the next breakout session. And you can check out the future offerings on Sched for this conference. Thanks again for attending. And thank you again to our presenters. That was really great information. And it's, yeah, this is why I love this conference, just getting to hear more about what our colleagues across the state are doing. Thank you.
Thank you, everybody.